Hi, I'm Christie, and I'm so glad that you're here. If you're watching this, chances are you're experiencing chronic pain or chronic symptoms that have been extremely difficult to navigate. Maybe you've been searching for answers, but everything you've been told so far feels like it's coming up short. For a lot of us who've experienced chronic pain and chronic symptoms, the symptoms and the pain aren't even the hardest part. It's the confusion. It's the frustration of so badly wanting to feel better and still not fully understanding what's going on in your body. Maybe you've had test after test and you've been told that everything looks normal. Maybe you do have a diagnosis like arthritis, degeneration, or an old injury, but the treatments that you've been recommended have not given you the benefit or healing that you anticipated. Or maybe you just have this gut feeling that something else is going on and that you haven't been given a complete explanation of what's going on in your body. If any of this sounds like you, I get it. Not just because I'm a therapist who treats chronic pain every day, but because I've experienced it myself. I suffered from chronic pain for about 10 years. I had pain from head to toe, along with other symptoms as well, like fatigue and vertigo and dizziness. I've cried in more doctor's offices than I can count. And when I was in pain, I distinctly remember this feeling of being so far away from myself, like I was a shell of the version of myself that I imagined I could be. I was so lonely. I was so depressed. And above all, I was honestly just really, really angry because I wanted so badly to get better. And I feel like every treatment and every doctor just sent me in circles or down a dead end. So if any of this sounds like you, if you've felt dismissed or cast aside or frustrated, I really, really get it. And I'm here today to talk about the possibility that there might be more to your pain picture than you've been told up to this point, and that there's a really hopeful path forward. One of the reasons why chronic pain can feel so frustrating is that many of us have been taught a very simple model of pain. Something gets hurt in your body creates pain, you fix the damage, and the pain goes away. And sometimes that's exactly what happens, especially in the case of acute injuries. But we're finding that pain is often a much more complicated picture. Researchers have found that structural findings on scans, things like disc bulges, degeneration, even tears, can occur in people who have no pain at all. And then there are people who have severe pain who have none of these findings on their MRIs or scans. You could even take two people who have nearly identical MRIs, and they might have vastly different pain experiences. So this is telling us that pain is not simply a readout of structural damage. And that does not mean that your diagnosis is wrong or that structural findings are all irrelevant. But it does tell us that structural findings are often not giving us a complete picture of what's happening in your body. And when treatment only focuses on tissues, or only focuses on joints, or only focuses on the spine or body mechanics, we might be leaving out one of the biggest drivers of chronic pain altogether, the brain. Most of us have not actually been taught what pain really is. Most of us have been taught that pain lives in the body, but in reality, pain is generated in the brain. And I want to be really careful here. In case you just had the thought, is she telling me my pain is all in my head? I want to be really clear. I know your pain is 100% real. Not imagined or exaggerated or just a stress response, and certainly not a character flaw. But the reality is, science shows us that all pain comes from the brain 100% of the time. And all pain is real 100% of the time. Even when you stub your toe doesn't store or generate pain. Your toe sends signals up to your brain, and your brain decides whether to turn pain on as a protective response. Because that's what pain is. Pain is protection. And your brain is constantly scanning your environment, both internal and external, to decide if it needs to warn you about something that might be dangerous or perceived as dangerous. So yes, your brain takes into account physical sensations, but it also takes many other factors into account. Things like your stress level, your sleep, your relationships, your social environment, pressure, fear, trauma, the overall state of your nervous system, and the uncertainty that you're carrying. All of these social and emotional factors are a part of your pain equation. And when treatment only focuses on physical mechanics and leaves out these social and emotional factors, we're missing a real opportunity for healing. That's why so many people begin to improve when they start utilizing their brain as a recovery tool. And honestly, I think this understanding of pain is really hopeful because the brain has the capacity to change. I see it all the time with my patients, and I felt it myself. So whether you've been searching for answers for a long time or you're newer to the process, whether you have an injury or your pain came out of the blue, whether you have a diagnosis or you don't, I believe there are more avenues for healing than you may have been told before. People get better. I got better. If any of this resonates, if you've been searching for a full picture but haven't found it yet, I highly suggest giving Curable a try. It's a program built around this complete understanding of pain. And whatever you're already doing, Curable is something you can use right alongside that. And if you give it a try, I'll be rooting for you.